right. So thank you all for coming. I know it's probably hard to sit in a room like this with the sun actually shining. But just a little bit about my background. I actually started out in shelter medicine. I got my undergraduate degree in communications and then was sitting in a cubicle one day and said, if I could do anything, what would it be? And so I was like, I'd be a veterinarian. And let's see if I could actually handle it. So I started volunteering at Multnomah County, and it was before their huge, awesome remodel and way back in the day. So they've come a long way, and I got to start at ground level cleaning cages and worked my way into the hospital, and and then actually started working at Dove Lewis at the same time as a technician assistant, and worked my way up to being a vet tech after several years, and then got into vet school. So I completed my internship in emergency and critical care medicine here at Dove Lewis, my first year out of graduate school from Oregon State University, and then went into general practice. So I kind of skipped all over the board as far as veterinary environments to work in, and that gave me an interesting perspective on fear-free veterinary visits, because the ER, the shelter, even going to your regular veterinarian if you have a medical condition or if you just have a very anxious animal, all of these can be very fearful events, and there are things that we can do to help it be a smoother process for them. So first of all, why should we even bother having fear-free vet visits? Why is it important? Why can't we do it the way we've always done it? And first of all, how many of you guys have seen this one lately? A pug nail trim. Their eyes are bulging out of their head, they're hyperventilating, sometimes they pass out and you trim their nails really quick. And it shouldn't be that way. We shouldn't need, as it says, 6 adults, a sedative, and an exorcist. It's just not necessary. And if we can make it a better experience for the patient, we're going to be able to do more for them. They're going to be more, they're going to allow us to do more for them and to them. And it's going to make it so that we can provide better medical care. For clients, they're going to be much happier if their pet is not afraid to come into the vet. They're going to be more likely to make an appointment when something's wrong rather than trying to sit on it and see if it's going to get better. They're also going to be more willing to come back for rechecks if their animal didn't turn blue and pass out during the exam. It's easier on the staff as well. Between the clients and the staff, these are the reasons that, and the patients, these are the reasons that they've redone a lot of pediatric units. Gone are the days where you hold down a child and do what needs to be done because it's in their best interest. They don't understand their situation. They don't know what's going on. All they know is they're in this setting and it hurts. And that's the same issue that we're dealing with our pets. We're in this setting and it hurts. And when our staff, we're in this business because we love these guys. And if every single pet that comes in is like a pug nail trim, you're going to burn out. It's not fun anymore. So you also, if you have a fear-free setup, you're going to have less injuries. You're going to have less bites, less scratches, less injuries from manhandling. You're going to be less frustrated because you're not trying to crank through several appointments that are like a pug nail trim. And you aren't going to burn out because you have all these animals that are excited to come see you. So this is one of my favorite pictures ever. I had to put it in here. Isn't that just... there's a lot of Chihuahuas you see that have this look on their face. So physical effects of fear, it does elevate their temperature. It's going to elevate their heart rate. It's going to make their respiration go up. Our blood pressure readings are not going to be accurate. They're going to be artificially high. In cats particularly, their glucose goes up. And their glucose can go so high that they're dumping glucose into their urine as well. And we might be falsely typing them as diabetics. We do see changes to the white blood cell count. We have a name for it in the business. It's a stress leukogram. And it's related to the shifts that the white blood cells do during stress. They are more likely to throw clots, which is not something you want in a pet that you're going to be doing surgery on, especially. Increased cortisol levels, as Lena was talking about, it decreases your immune system, and it's going to cause delayed healing for a lot of these guys. Stress diarrhea, we've all seen it. It's not pretty. Stress cystitis, especially in cats. This is exactly what she's talking about too, feline lower urinary tract disease. We can actually be causing blockages in the urinary tract due to a stress-related event, like going to the vet. Upper respiratory infections, sometimes we'll see that flare up of viral upper respiratory. And also, when animals are stressed, we're lowering the seizure threshold. That means animals that have seizures or are prone to having seizures are going to be more likely to have one. And so all of this begs to the question, how accurate is our exam and our lab work if all of these things are happening as a result of our exam alone or drawing blood work, trying to do diagnostics? So, I know, isn't it sad when you have a scared puppy? It's like, that's the worst. And psychological effects of fear, it's adaptive. When you first have a new puppy, a new kitten that's coming into your practice, they're happy to be there. They don't know anything else. They're like, woo! Unless they're coming from a rescue situation or they've had some other things in their background, they're excited to see us. And we're taking pictures, and we're super excited about that new puppy, new kitten exam. Well, after the first year, they've had 3 sets of vaccines. They've probably, hopefully, been microchipped. They've been spayed or neutered. They've had their temperature taken multiple times. They're not as excited to see us anymore. And as Lena was talking about, that chronic fear where they're coming in and it's becoming more and more stressful for them during that whole exam period or maybe even hospitalization, we're changing how their brain handles fear. Especially the amygdala, where it modulates their fear response. And what this means is that we're creating a form of PTSD. And I don't know about you guys, but I took this oath, and it started with first do no harm. And that's important. So fear is also a major obstacle to veterinary care. They did a study. Bayer collaborated with an independent consulting group called Breaky. And in 2011, they started releasing their findings, and they were trying to figure out why owners were not bringing their pets into the vet during this time. Vet visits had dropped immensely, and it was during the recession too, but they didn't feel like that was the only reason. And so they actually went out and asked people, why won't you go to the vet anymore? Well, just thinking about going to the vet is stressful. And that was 26% of dog owners. That's a quarter of the dog owning population not excited to go to the vet. Cat owners, even higher, 38%. My pet hates going to the vet, hates going to the vet. Who wants to bring their animal to the vet knowing that they hate it? Well, dog owners, 38% felt that was true. And cat owners, 58%. That's huge. 60% of cat owners probably not going to make that appointment. So another study that came out in 2009, this was talking about fear-related behavior of dogs in the veterinary practice. So dogs that had to be dragged or carried into the practice, what do you think the percentage was? Any guesses? 15? You're close. 13.3. Dogs that entered the practice calmly, actually walked in, weren't fazed by it. What do you think? 7. Well, they're saying definitely less than half. At least half are not happy to be coming into the vet. Dogs that were fearful on the exam table. How many? What's that? Over 50? On the table. Dogs that hate being on the exam table. 70, 80. 78.5% of dogs hate being on the exam table. So in the last couple decades, we've developed a whole new science in veterinary medicine. There's been a lot of pioneers in this area, but it became official that we have veterinary behaviorists. And they were amazing. They came out and actually showed us how to identify stress in animals and what we can do to mitigate some of that stress. Sophia Yin, amazing pioneer in this field, showed us that there are things that we can do during an exam that we can handle them with low stress. We can use other motivators than fear to get these guys to participate in their exam. She actually set up a certification for low stress handling, and her company still carries on this certification. It's a series of videos, training modules for your staff. There's also some great resources for them to read up on. And you have to have a certain percentage of your staff that completes this course in order for your practice or your business to be labeled as low stress handling. Karen Overall was also one of the latest behaviorists. She's the one that is spreading the word about, I should say there's many people doing it, but big voice in this industry spreading the word that fear causes brain damage. And this was something that she is known for saying, any dog or cat that is not physically ill should be able to happily walk into the door of a veterinary hospital. So the latest and greatest finding, how many of you guys are familiar with this guy? Marty Becker, America's veterinarian. He actually went to a talk by Karen Overall and was shocked to hear the link between fear and brain damage. And he instigated this Fear-Free Council. And this is a group of veterinarians and veterinary specialists, and their whole goal is to create a guideline for veterinary practices to become a fear-free establishment. And they're actually working towards getting a certification process in and of themselves. Some of the things that they talk about include having decreased volume of vaccines, using oral vaccines when you can, using a lot of pheromones, which we'll talk about, as well as just using different behaviors and guidelines that we'll also be covering too. But they have, you might start seeing these handouts around. I didn't have enough to pass them out, but this is their new fear-free flyer. And they're passing these out to veterinary hospitals to start the movement and get people thinking about things that they can do in their hospital to make it a little more fear-free. So in order to think about what we can do to make it a fear-free environment, we need to think about how our pets are perceiving their environment, because it's different than us. First of all is sight. So dogs and cats have the ability to see within the UV spectrum. How many of you guys have ever shown a black light on urine to try to find where it is? It glows. This is how they know where to mark stuff. Amongst smelling, but it's one of the ways they know exactly how high they need to pee on that tree to make it theirs. So what else glows in a UV light? You know, ringworm, hopefully, 30%. But anything that's white. And what do we like to have in our hospital establishments to make it look clean and sanitary? White walls, white floors, white jackets, everything's white so you can see if it's dirty. So I'm coming in with my little white coat thinking, hey, I'm super happy to see you. Are you happy to see me? And this is what they see. Wah! You know, if you're walking into a white room with a white coat and you are really sensitive to those wavelengths, it's like walking into a rave. It's just too much stimulation. So some things that we can do to mitigate that. Try to do natural or low lighting. There are several vet practices that are having windows in their exam rooms or skylights, and this can be carried over into rescue organizations, kenneling areas. You know, having that natural light is more relaxing to them. Having, I say, pleasing colors. They're actually recommending pastels. Might not be pleasing to everyone, but tends to be a pleasing eye candy to dogs and cats. I don't know how they test this, but it's something that some of the architects that are working towards the fear-free movement are recommending. Ditch a lab coat, especially if you know that you have an animal that's fearful in that situation. You know, we used to think that we had white coat syndrome. And first of all, that's where the clients don't tell you, or don't tell your staff what they want to tell you when you walk in. But also that an animal sees you in their white coat and they're scared because they think you're going to hurt them. You know, I've heard this from a lot of clients. They're afraid of white coats. And it might not be that there is a pain or fear association with the white coat as much as it is you're glowing. So usually for my exams, I'll actually wear my Viking track jacket, especially if I have a rescue or a new puppy or somebody that we really want to make sure that we don't cause any additional fear. Separate entrances and waiting areas, trying to separate the species or animals that are more reactive. We have a separate cutout in the back of our waiting room, and that's where cats can go. That's where dogs that are reactive to other dogs can go to just quietly hang out if we can't get them into a room right away. There's been some creative elaborations on this, especially if you get your fear-free certification through the American Feline Practitioners. They have some great ideas as far as putting in curtains, using visual barriers, having plants, having big screens that you can separate clients with. So if you don't have a waiting room that's already separated, there are some ways that you can put in barriers. So smells. This is a huge way that animals take in information. And one thing that we haven't been as cognizant of is that even a 1% solution of bleach kills a large amount of their olfactory neurons. And this is the chemical signaling in their nose that goes to the brain to tell them the information they're taking in. We're killing that off if it at all smells like bleach in there. And that can be very stressful for them. You've suddenly eliminated or impaired a sense. So a couple things that we can do, choose cleaners carefully. One of the things that they recently found with cats is that they seem to have an aversion to citrus smells. And I know a lot of our cleaners are citrus-based because it's pleasing to people. But also, stay away from the bleach if you can. When you have an animal that's going to be hospitalized or it's going to be a stressful event, they're going to be in a carrier for transport, have something that smells like home. And I'm actually surprised so many veterinary hospitals are very adverse to this. And it's, they don't want the responsibility of an item that comes in and it's going to get lost, it's going to get soiled, it's going to get otherwise mutilated. But in my experience with my clients, if I make sure that they're aware of that, they are more than happy to come up with something that they're not as attached to in order for it to comfort their pet while they're there. This is little Evie. She's waking up from her spay, and her mommy's made sure that she had her princess blanket and Ratatouille, so that she would know that when she's waking up, she's in a safe place. So also cleaning out the air between appointments. Even if you have a fan that you can flip on, if you have doors that you can wave open, if you have a tremendous amount of information that's hanging out in that room when a pet walks in. You might have people that are smokers. You might have animals that are intact. You might have an infection that smells. You guys have all smelled like that horrible yeast, infection that fills up the whole room. No one wants to walk into that afterwards. And imagine if you're primarily made up of nose and you're walking into that room. It's a lot. Just trying to make sure that there's as much airflow between the rooms as you can between appointments. Pheromones. I love pheromones. And are you guys familiar with Adaptil and Feel Away? There's not a whole lot of science that backs up that it's effective, but there's a lot of anecdotal information. And it's not going to hurt them. Pheromones for cats, the Feel Away, it's based off their scent gland on their chin. So they're rubbing on things and marking it as theirs. And the world's a safe place because it all smells like me. Dogs, it's more from the mammary secretions that moms produce while they're nursing their puppies. It just says, you're good, relax, you're okay. Some animals, doesn't make a difference. Others, I had the opportunity, I walked into a nervous Great Dane appointment. And I love Great Danes. I have Great Danes. And when I have a nervous Great Dane that comes in, it's like a bull in a china shop. If they decide that they're not going to let you do anything, you're not doing nothing. So I had sprayed myself with Adaptil, walked into the room, and this guy, walked right up to me, and the owners are very nervous because he hasn't done well at vets in the past. And he put his head in my stomach and just went, and he just stayed there while I'm petting his head and stuff. They thought I worked a miracle. And I'm like, yeah, I'm going to put a note, use Adaptil for this dog. Hospital policy, have something in place regarding scents for your staff especially. We don't want a whole bunch of heavily perfumed lotions, any products. If we have anyone with allergies, there are probably a huge underdiagnosed plethora of asthma cats. And if we're walking in and we have all these scents on us, they're going to have trouble breathing, and that's going to create a stressful environment too. So have a species-specific exam room if you can. This is our cat exam room. This is our boat. I love our boat. The cats love our boat. So when they first come into our cat-only exam room, we encourage them to come in with their carrier, open up the door, and let them just roam while our technician comes in after them, or while we're taking a history, and they're allowed to explore the whole exam room. This is Roman. We added a scratching post. So Roman was checking out the scratching post. He's going for a sail. He's checking out the shelves underneath. And Roman loves coming to the vet now. He's pretty pumped to come play in the cat room. And as soon as we let him out of the carrier, he's like, woo! And he runs over to the boat and gets back on his scratching post. So sounds are really important too, because most of these guys, primarily pets are indoors only these days. And that means that they're super sensitive to the door opening and closing, to the phone ringing, because these are events in the household. Something's happening. They don't hear a lot of other animals snorkeling and walking by. They don't hear a lot of barking, hopefully. So all this hospital noise is just too much stimulation. We're overloading their senses. It's like being in a foreign country, and they don't know the language, and they don't know the customs. Everything smells weird. Everything's off. So what can we do? Well, first of all, go in and take a thorough history. And this isn't just to get more medical information. This is so that you have a dialogue with the owner. And if you go back to the foreign country, you think about if you're traveling with a friend, and your friend speaks the language, and your friend knows what's going on, and they're not worried, then you're like, okay. We're not going to get eaten. We're fine. So sit down and have that dialogue with the owner. Use a low voice. If they see that their person is relaxed and interacting with you, they're going to be much more willing to do so as well. Soundproofing. This is especially important if you have animals that are kenneled in the area. Trying to make it as quiet of a situation as possible. Again, trying to decrease that level of stimulation. So white noise, having soft music in the room, having a fan on. They do have these special doors. I have these in my own hospital. They were recommended by the architect, and it's actually a brilliant idea. There's a little catch. This is the hinge side of the door, and there's a little catch so that when the door closes, weather stripping goes down to the floor. And it cuts off smells, it cuts off sound. It's actually quite amazing how much sound does not reverberate from the back treatment area to the front, because this little strip of soundproofing that helps make an additional barrier out of your exam rooms. Having your staff be cognizant of all the noise that they make. I actually was at a hospital where we were required once every couple months to go and sit in an exam room for 5 or 10 minutes and just listen to all the noise of the hospital. And you don't realize how loud it is until there's nothing else around you, and you can't be on your phone. You just have to sit and listen. And there are people shouting across the treatment area, "Hey, can you get me that? Hey, so-and-so's up front. Can we bail out this person? Are they ready to go?" They're interacting, but it's loud, and it's not voices that these guys are familiar with. The phone is also ringing, and if you can make it to a lower tone so it's not as shrill, you want to get everyone's attention, but at the same time, you don't want to make it another invasive sound for these guys. And one thing that we instituted at our hospital, and I know several others have done this lately too, is having an instant messaging system. And this is so the people in the front can communicate with the people in the back. And that's less people walking, that's less doors opening and closing, that's less people yelling, "Hey, is so-and-so ready?" It's a great way to communicate without that additional noise. Taste. This is an excellent distraction, especially with dogs. Cats, you really have to work for it. But dogs, get a high-quality treat, and you'll be amazed at the difference it makes. Especially if you ask the owners to fast them before the exam. So don't feed breakfast. You're coming in for a 10 a.m. exam. Think about how you feel when you're at a restaurant and you're starving. And that server comes around the corner with your meal, and you're like, yeah, you know. If I walk into an exam room with a cup of cheese and this dog is hungry, that's going to override their nervousness about the situation most of the time. And make sure it's a high-value treat, and treat early and often. We use cut-up string cheese in these little containers. We will meet owners up front with a string cheese. We'll have it available for our receptionist to give out. We'll have it on the scale. We'll have it in the rooms. We actually, and I think we were doing it unconsciously, but now we do it on purpose, walk around shaking these containers. And it was to loosen up the cheese bits. And now, as soon as we start shaking the cheese containers, the butts start going. Not the staff, the patients. So don't forget to treat kitties. Some of these guys, I'm actually surprised, especially in an exam room that doesn't smell like dogs, they will actually eat the treats. Oh, and there's Kelly. So this is an example of kind of the perfect way to comfort an animal during an exam. So this, Kelly's with Northwest Animal Companions, one of our rescue partners, and these little puppies were emaciated. Like, there's no other word for it. They were really underweight and sickly, but doing okay. So if you look at this picture, there's a couple things. You know, we're on the floor. We're not on the exam table. We're on the floor. We do almost all of our exams on the floor because 78% of your patients being scared of the exam table, it's not acceptable. So if we need to go to the floor, you can see the overhang of the blanket here hanging off the exam table if we need to go up there. It's covered. It's not a slippery surface. It's warm and inviting, and it's cushy for some of these older arthritic animals. Animals tend to be sensitive about their head. You know, that's where they're taking in all that sensory info. And if you walk in and you go straight to the head, they're not going to appreciate it. But unfortunately, in vet school, we're taught start at the head and work backwards. And we need to kind of rethink how we do that these days. Thermometers. Thermometers. Now, the only dog or cat that likes to be temped is like that happy lab that doesn't care. But this is not how we make friends. So thermometers, we'll talk more about that. Hospitalized patients. When we have an animal that is staying with us and we're having to do treatments on them throughout the day, they start to be sensitized that every time we open that kennel door, something bad's going to happen. You know, something's going to happen, and they're probably not going to like it. So with our hospitalized patients especially, we need to make sure that we're getting some good touch in there. We're coming to visit them between treatments so that they know it's not such a scary thing every time that kennel door opens. So pay attention to surfaces. Try to get flooring that is not super slippery. If you do have flooring that's slippery and not textured, having throw mats down. I've actually walked a patient from the front to a room, like moving non-stick mats all the way, trying to make it so that they're not on a slippery surface. They have these great rubber-backed mats at Costco for $10, and they're like, whoop, perfect giant bath size. You know, we put those on every table, on every floor. It makes a big difference. We put them in the kennels, too, especially for the giant breed dogs that if they're nervous and they're standing for a long period of time, you know, they're going to be sore when they get home. And that's another thing that they're going to attribute to their visit at the hospital. So pay attention to surfaces. Turn petting into an exam. They've actually shown in recent studies that having steady, constant pressure on an animal is soothing. So it goes along with massage and T-touch, thunder shirts, just having that steady pressure is soothing. And if you look at these guys, you know, they're supporting him. We're here. You know, we're also holding you still because you're a cute little wiggly puppy, but it's also soothing to them. They feel like someone's got me. Don't start at the front. Like, there's no reason to. You can mix up your exam. And I will frequently kind of turn petting into exam. I'll sit down on the floor and wait to see what the animal presents me with while I'm feeding them cheese. Some of them come sit in my lap, and I'm like, okay, we're starting in the back. You know, some of them will come up and sit next to you, and you just pet their chest and start checking for lymph nodes. Some of them walk right up and hi. You know, go ahead, start at the head. So the human-animal bond, I consider this the sixth way that animals perceive their environment. Is what is my human thinking? And we need to take that relationship with the owners and the fosters with that pet into account. is anxiety being communicated? If that person is nervous and they're bringing their pet in, that anxiety is traveling right down that leash into that animal. And also take into account your staff that's handling the animal. If you have someone that is having a crisis at home or an emergency or some horrible breakup, unknowingly they're going to be, unfortunately, bringing that into the room with them. We're human. You can't always leave the drama at home. So maybe we need to be more cognizant of that. Maybe they're on lab or laundry duty that day, and someone else who doesn't have as much going on handles the animals that are especially anxious. So what we can do, take care of the human. And this is especially important in an ER setting. Get them something to drink, make sure they feel listened to, let them know there's a plan and we're taking care of your animal. If they can relax and their animal's there and bleeding and upset and they see the owner being like, okay, we have a plan, then they're like, okay, I don't know what's okay, but we're okay. So just take care of the human. Going through tricks can help. If an animal is trained to do certain tricks with commands, it's relaxing to them. It's like an anti-anxiety where you go through the street names, whatever things that you do, whatever thing you do to help yourself relax. We're laughing because we're just talking about a show that she does that to help decrease her anxiety, is go through the streets of her childhood. And I was like, that's perfect. That's exactly what dogs do. They go through their tricks. And especially if you come in with the cheese, they start showing you all their tricks. And remember, you're in a foreign land. Make sure that you're engaging the owner and the foster. Because, like I said, if they feel like they're okay, that's going to translate to the pet. Body language, we could go on about, that could be its own separate talk, but just to give you a quick overview of things that we're looking for signs of stress in our patients. Panting, if they won't walk into the room or even in the front door, if they're vocalizing, if they're hiding under the chair, if their hackles are up, if they're growling or hissing. I'm not going to be pushing through this exam. We're probably going to stop and do some sedation, either sending home with oral sedation to come back later in our happy place, or we're going to do some injectable sedation. And it's really important that you make sure that your staff and the owners do not punish these signs of stress in their pets. I appreciate having this warning. I very much appreciate having this warning. That tells me I need to stop. But if we're ignoring these warnings and we're trying to power through it, guess what? This patient next time is going to be even worse. And they may not give you those warnings. They might just come in the door and be like, nope, done. And then someone has to go to the ER and get antibiotics. So body language, additional things, what can we do? Maybe if we know that this is a high-stress animal or the owner gives us a heads up, we meet them in the parking lot or in the waiting area with treats. We have them ready. So as soon as they walk in, they're like, oh, this place isn't so bad. Sit down like we discussed, talk with the owner first, have that dialogue, use a nice low voice, let them come to you. Don't go chasing them out from under the chair. Just sit down, talk with the owner, have your treats, don't make eye contact, let them come check you out. Approach from the side. If you go straight at an animal head on, that's a very aggressive move in animal language, and they don't appreciate it. So take your time. If you're going to approach them, come at them from the side. Like I said, sedate sooner rather than later. If you wait for the animal to get super wound up before you sedate, you're fighting adrenaline. It's going to take a lot more to sedate them than it probably would have initially. And the trouble with that is as soon as you actually get them sedated to a point that you can do their exam, they might actually be too sedate. And then we have to hurry up and reverse some of that because it's not safe. And assess what's necessary to do today. Do we need to do a nail trim before our exam? Probably not. Maybe that's something that we need to schedule as a technician appointment later. Frequently with new puppy, new kitten appointments or with new patient appointments, when they're new to the hospital or new to someone's house, they've just been adopted, I will talk to them about maybe we don't do the vaccines today. Maybe this is just our happy welcome visit. We're going to talk about some stuff. We can come in next week as a technician appointment after they're settled into your house and your environment. They feel more safe with you and with us. It's not as scary. The first time they come in, we're doing something that could potentially be invasive. We've just set up our relationship with that animal. So human or no human, do you want them there for doing lab work or vaccines, or do you not? And honestly, I say ask the human. If they are anxious about needles, or they don't want any association with anything bad with them and their pet, then they don't have to be there. But that doesn't mean you take the animal to the back. What I do is send the owner to the front. We don't want that animal to be thrown into a whole new situation of sights, sounds, and tastes, everything. So we're just going to, okay, well, how about you wait up front, and we'll bring them right up to you after we do whatever we need to do. And also, I try to do as many things as possible in the room with the owner, so it's not a mystery, first of all, for them, what happened to their pet, and also so that the pets know if their owner's calm, they're calm. I try to draw from a back leg, primarily. I find that animals do not appreciate any needles going in anything neck-like. So trying to stay away from doing jug draws. Use as small needles as possible, especially for vaccines. And then use distraction. Use cheese. Bring in toys that they like. Have something squeaky. If it's a dog that loves their squeaky, you can do amazing things just by holding the tennis ball for some of these guys. And then always pair a negative with a positive. So, we're doing vaccines, but you get to eat all this cheese while we do it. We're doing a blood draw, but we're going to pet you through the whole thing, tell you you're good, and you get a reward at the end. They start to associate. These guys are smart. They're going to associate, okay, I'm going to let them do this because I know there's a big container of cheese sitting right there, and I'm going to watch it the whole time, and I know I get it when I'm done. Sedation, like I said, sedate early and often if you need to. You can discuss this with your vet in advance. If you already have a client-patient relationship, I can prescribe something and send it home with you for your pet before they come into the hospital. Heidi Schafford is on the Fear Free Council with Marty Becker. She's an anesthesiologist in this area, and she's actually developed this great gabapentin protocol for cats. And we send you home with gabapentin. You open the capsule, mix it with some canned food, put some Fortiflora on it. Cat eats it 2 hours before the exam, and they're like, woo, this is not so bad. For dogs, I typically use trazodone or alprazolam. These are anti-anxiety medications. They're not just sedatives. They're helping to take down the anxiety level of the animal. I always say if you think your pets may need some injectable sedation, even if it's on top of the oral sedation, don't feed them breakfast that day. And acepromazine, thing of the past for most situations. I don't know how many of you are familiar with ACE. It used to be the go-to sedative for these guys, and we have found that it does nothing to decrease the anxiety level in the pet. So we're just sedating them, and they can't do anything about it, and they're still anxious. And what that means is the next time, they're going to get worse and worse every time they come in. So some resources that your organizations can look into for low-stress handling. Of course, Sophia Yin. This book is amazing. I require all my staff to go through it and watch all the videos as well. Also, for cat handling, the American Association of Feline Practitioners actually has this wonderful guideline. It's a huge handbook of ways that you can make things as stress-free as possible for handling cats. And then after the visit, it doesn't stop there. You're not done at the exam. They can still have a bad association, and we need to fix this. So, end on a positive note. More treats, more toys. This is our booty box. Anyone that comes into Viking gets to pillage the booty box at the end and take home a toy with them. And this erases everything we have done as they leave. And then take note. You've just figured out what works for that pet. Let's not recreate the wheel every single time. If they did better with standing nail trims, let's put that in the record. Which leg worked best for blood draw? Let's put that in the record. Do we have a favorite treat? Do we have a favorite staff member? Does this person need to have sedation sent home beforehand? Put all that in the record so that it's flagging us. And then it makes it so that we're providing better medical care. And it's also going to save us on time. If they have a multi-pet household, talk to them about how to reintroduce their pet once they've gone to the vet. If they have an anxious animal at home and they're coming home with the dog that smells like the vet, especially if it's a new animal to the household, you need to talk to them about taking those two for a walk together as soon as they get home, reestablishing that pack mentality. If you have a cat, you need to take the bedding and rub it on the cat when they get home so it smells like the other cats in the household, or use a shared brush between all of them. How often do we bring our cats home and then the other cat in the house is like, not ideal. So trying to take that out of the equation. And fear-free pet care starts at home. Trying to get them desensitized to the carrier before coming in. This is a fantastic infographic by the American Association of Feline Practitioners. This is on your handout that I put in the back. The fear-free handouts I brought in, that is what we have handed out to every new client, new patient, anyone coming in, anyone who needs a reminder of what they can do to make things better for their pet. So this is a great one. It just talks about how can we make the carrier not so scary. Other things, doing soothing music in the car, trying to keep it low-key. Again, teaching tricks, having them run through their tricks when they get in. This little guy showing Lisa, my technician, howdy. I was like, oh my gosh, that's so cute. Desensitizing their body parts prior to the exam. This is something that you can do at home. Handle their ears, handle their feet, lift their lips regularly to check their teeth. And you can pair these with tricks and commands so that, if we're just running through another set of tricks at the vet hospital when we're doing these things in that setting. You can also ask to bring home a syringe and desensitize them to it. Animals know what a syringe is. There was a movement in the veterinary industry that they told vets, if you draw up a vaccine in the room, it shows the owner that it's a high-value commodity. Well, guess how many animals also realize that you're drawing up a vaccine in the room, and that's going to mean that they're going to get poked. They know what a syringe is. So bringing home a syringe, having it be a command so that, we're touching you with the syringe. You pick up the areas over the shoulders or over the back legs and pretend that you're touching them with the syringe and pair it with a command, with a treat. And this is my staff. So, this is one of my best resources. These guys have come from so many different places, and they're going to think of things that I haven't thought of. So talk to your staff. See what everyone thinks has worked and what hasn't worked. Also, it's really important to have your whole staff on board if you want to have a fear-free establishment. If you have one person that's bucking the tide because they just want to get through the day and we're going to scruff this cat and hold it over for a nail trim, you really need to have a talk with that person and make sure that they know it's not okay, because it only takes one person to kind of throw off the whole vibe, and just stay on top of it.